Welcome to Mind Body Besties, your weekly reset with real talk, a little laughter, and the kind of honest conversations you'd have with your closest friend. I'm Caty, a therapist.
And I'm Rachel, a naturopathic doctor. We're here to share the personal stories, struggles, and wins that have shaped our own health and happiness. This isn't a lecture, it's a safe space to slow down, connect, and feel a little more human again. So grab your coffee, get cozy, and let's reset together.
Hello, everyone. So today we have a really cool episode for you guys. We are talking to Dr. Orie Quinn. He's a chiropractor and like a functional medicine specialist, in my opinion. I personally have gone to him several times. I've taken my daughter to him for certain issues. And so we're just really excited to have you here today.
Yeah, thank you so much.
Yeah, Dr. Quinn, do you want to share? I feel like most people in the holistic space have a neat story about why they got into holistic stuff, or else you probably would have gone a more conventional route. So do you want to share a little bit about what got you into holistic medicine?
Yes, I always love getting the chance to share this story because, so my father was a chiropractor, so I was already kind of maybe oriented in that direction. In fact, I went off to chiropractic school to become a traditional chiropractor. Like, you're going to adjust some spines, you're going to focus heavily on the spine and help people with back pains, neck pains, that kind of thing. It was about like a year into chiropractic school. All of a sudden I started having seizures, like out of the blue, like never had them before in my life. It all started with a grand mal seizure, and it resulted in this process of hospitals, of neurologists, of working with different doctors, trying to figure out what the answer and solution was. And it ended up going on for months. In fact, I ended up having like 2 grand mal seizures a week and like several petite mal seizures every single day. And it was kind of hit this moment where I almost gave up on chiropractic a little bit. And like, because everyone in my school and the professors were like, oh, we should be able to help you. You should be able to fix you. You should go see this guy, go see that guy. And nothing was happening. The neurologist just wanted to put me on medication, which I kind of grew up with that perspective of, prescriptions don't always fix everything, right? Like, because of my dad being a chiropractor. And this was like a moment to kind of like live that, where like all they had to give me was these prescriptions, and the prescriptions just made me feel worse. In fact, I started failing my classes because I couldn't remember anything. And it wasn't the seizures. In fact, so I stopped taking the prescriptions. I managed to get back into school and finish passing my classes and get everything where they needed to be. And it went on like this for like 8 months. And another one of my students or fellow students at school, like, told me about this doctor that was down in Austin, Texas. He was like, hey, he helped me. I had like kidney cancer at one point, and he helped me like through the recovery process of that. And he's kind of different. I think you should go try him. And at that point, I was open to anything. I was like, I'll go anywhere. And so we took the drive, like 3 hours down there, and his name's Dr. John Bandy. And he puts me on his table and he starts this process called muscle testing, which I think we're going to end up talking more about that in a little bit. But I had never seen this before, didn't know what it was. I honestly thought it was kind of weird. And after the session, which wasn't even like that long, it was like 30 minutes, he was like, I just keep testing that your mercury levels are too high. And I was like, how do you know that?
Yeah.
Hospitals, I've done so much blood work. Like, how do you know this? And he was like, this is what you need to take. And he sold me, I always joke around because he sold me this, like, it's like a $15 bottle of a supplement. And I was like, I literally have like tens of thousands of dollars of hospital bills at this point in time. And we left there, and I just told my wife, I was like, I don't know about this. And so I finally decided, I was like, I'll just do it. I'll take it. Like, who cares, right? So I take the supplement. 2 days later, I told my wife, I was like, something is different. My petite mal seizures almost stopped within like 3 or 4 days. And then I had the last grand mal seizure I've ever had like a week after I started this supplement. And,
Wow.
and then I never had seizures again. And I've never had seizures since. And it was just this crazy eye-opening experience. And I immediately contacted the doctor again and was like, what do you do? How do you know this? And like, how does this work? And the result of that was then I ended up, finishing up chiropractic school, doing my doctorate degree, and started doing postgraduate work in what's called applied kinesiology. I ended up spending, the next, 10 months, year of my life working with him down in Austin in order to like develop those techniques and those tools. And it just opened my mind to like there's so many more options than what get talked about. And there's so many other ways of like looking at our health than just a blood test, as useful as those can be sometimes, or like an imaging test or something like that. So
Wow, that's incredible. And also, while you were talking, I was like, I can't believe you were still able to go to school while you were recovering from multiple seizures a week. That's incredible.
I mean,
yeah,
yeah.
yeah,
Wow.
yeah. No, that part was pretty crazy, to be totally honest. Just trying to keep up with everything. I couldn't drive anymore, so I got like super lucky that, like, it sounds funny, but when we rented an apartment there in Dallas, like the person next to me ended up being in chiropractic school as well. Like we had no clue. We just like found a random apartment complex. Him and I literally started the same year, had never met before. And so he saved my butt. His name's Alan Glenn, and he just started driving me back and forth to school. He kept driving me throughout chiropractic school, and we kind of went through that together. So
Wow, that's
That's
amazing.
so
Well, I
cool.
mean, I have so many questions, but Caty, what are your thoughts?
okay.
Okay, what was the supplement he gave you?
Oh yeah, yeah. So that was all like, so it's selenium, which is
Okay,
crazy.
yeah.
Selenium, because it's like the simple little mineral, right? You're like simple little mineral, and like, why would that do such big a difference? And that's another thing that he really taught me in his time with me, is because a lot of people talk about heavy metal as just an example. This is how he like thinks about things. Like talk about heavy metal intoxications. So we give all these binders and all these things, and those have their place. I'm not saying that they're not appropriate sometimes. But he would always just go back to like, how does your normal physiology handle a particular problem? So when it comes to mercury, selenium is the natural normal mineral that the body uses to bind to mercury, what we call chelate it, so that it can be removed through the liver and kidneys without damaging the liver and kidneys. So if your selenium levels get too low, then you've got nothing to bind to it and you can't get rid of it. And so he knew that. And so every time I kept hitting mercury, he was just like, all right, here, you need a little more selenium in your life. He even asked me, he's like, where do you think you might have got exposed to it? And that was a big unknown. I later ran some genetics that would imply, like, I do have some of the MTHFR mutations and different things that imply like issues in some of those detoxification pathways. So it's possible it's just like the natural buildup. We do know that mercury's, now in our water supply, air quality, things like that. Because of industrialization, it does get put back into the system. And so it could have just been a slow buildup from that. We don't know. We don't totally know.
Wow, that's incredible. I love that it was selenium. Like, I love that it was this core mineral. That's amazing.
It's just
Yeah.
such a simple thing. And like no conventional doctor would ever just
Right.
give you selenium and say, this should fix it.
Yeah. Yeah.
Wow.
Yeah.
I'm
So
curious,
wild.
did you go back to your neurologist, or like, I don't know, it's always kind of like fun to follow up and it's like, oh, wow, you're miraculously better. But I was curious, did you follow back up with any of your specialists and tell them I took selenium and it went away?
Yeah. I probably wish I had, right, for that very reason. I know as a clinician, we run into that, right, where people go back to their doctors and they're like, keep doing what you're doing or whatever, right? In this case, I didn't, partially because it went on for so long. And when I started actually telling these doctors, like, I've got to stop this medication because I can't think, like, I can tell, like, that's like what, I don't know how I knew that. Like, I knew that that's what was affecting me. That kind of like really kind of broke that relationship. So by the time I went down to Austin, I really wasn't working with any particular doctor at that time.
That makes sense. Well, I'm curious, when you went and studied with Dr. Bandy, I think you said his name was, did you have a specific goal? Were you like, I want to focus on detox or something was there a particular focus, or were you just like, I want to learn this modality in general?
In that case, yeah, it was the modality in general. So, which is called applied kinesiology. It turns out that, like, unbeknownst to me, this sounds funny, but so it kind of developed back in the 60s, and there was kind of a group of doctors that identified how it works and everything. We can get more into that, I guess, a bit, but like, and it turns out, unbeknownst to me, that this Dr. Bandy, it was really kind of part of one of the original developers of like how it even worked. And so as I got further into the field and I'd go to the classes and the trainings and the groups, and they'd be like, who trained you? And I'd be like, Dr. Bandy. And everyone would be like, oh my gosh. And I was like, what's special about Dr. Bandy other than, I think he's amazing. And so the premise of it is I guess this would be a good time. So
Yeah.
it started with, there's a physical therapy book that was written by a husband and wife combination called Kindle and Kindle is their names. And it was like the standard process of the muscle testing procedures or something like that. And so they're the first ones that really identified this idea that, like, that you could isolate as best as you can, a specific muscle group and the action that it performs, and that you could put a resistance against it to test, does that muscle work properly or not? And the original premise was that there was a grading system where you would actually grade it like 5 out of 5 if it properly contracted, 4 out of 5 if it could hold its position in space and give slight resistance, but not full resistance. And then it'd be 3 out of 5 if it struggled to kind of hold itself up, and then you'd kind of back down from there. And so a chiropractor and Dr. Goodhart like read this book and thought like, hey, we work with spine and adjustments and things, like, could we use this as a bit of a diagnostic tool to see like if we do an adjustment and does it make a muscle go from a 3 out of 5 to a 5 out of 5 where it can actually resist that pressure. And so he started using this and started getting really, really good results with it. And it started presenting, because he started running into scenarios where he would do an adjustment and it would not activate that muscle, which happens a lot. And then he would ask the question of like, well, what else can we do to make this muscle work? And so it started off as simple, like hands-on modalities, like some of your like fascial release work or just like pressure points. And so they would then figure out like, oh, now we got this shoulder moving right and like stabilized. And as they saw more and more people and he started teaching it, and we started realizing there's all kinds of reasons why muscle might not work. And so that's what drove into the premise of like, sometimes it can be nutrition. Like, how do you test if it's nutritional? So that was a question that they arose with them. And the original idea behind that was they said, okay, well, we know we can put in a neurological input if we have you just put this nutrition in your mouth. And so one of the things that we can do with muscle testing, if we identify, for example, like a low back muscle isn't working right and people can't like bend over. Well, if you can find the right nutrition, just dump a little bit on their tongue, then you'll get this huge range of motion change where they can all of a sudden just like bend over and touch the ground. And then you're like, oh, and then that would tell us like, it's not a structural problem in this case. It's more of a chemical problem in this case. And that is really how the whole thing was like born. And then the whole group of doctors kind of joined in and got a hold of it. And so they started kind of going through this process of just like trial and error and figuring things out and documenting it all and writing research papers on it all. And we have a couple of different textbooks that we use in our space. And so that's really what, when I went down to work with them, that's what I wanted to learn, was like, because that's what he was like, it's not so much that I 100% know how to detoxify people every time. It's that I know how to go through the step-by-step process to identify that it is the liver not processing mercury and that we then need to give you the selenium. And so he kind of taught me that process.
That's amazing. Yeah. Caty, I wonder, so since I've done muscle testing a little bit, I'm wondering from your perspective, like what you might be wondering about, like what the point of muscle testing is.
Yeah. So, I mean, obviously I've done this, and I remember the first time that I had an appointment with you, Dr. Quinn, I was having a bunch of stomach issues. And I was like, my stomach hurts all the time. And I remember like I was laying on the table on my back and you were like, okay, put your arm up in the air. And so I put it straight up and you just started like pushing on it. And then you'd like pick up a leg and be like, all right, pull your leg out. And I was like, what is he doing? Like, what, how is he going to figure anything out from this? And then after that, you had vials of like, I think food, and there were also like supplement bottles, and you're like, all right, hold these now. And then you would do the same thing. And so like, what questions were you asking? And maybe what like muscles could you have been looking at? I mean, I'm sure you don't remember, but like, what could you have been looking at?
Yeah, no. So as they back to that history a little bit, it's like they go through this process of then trying to figure out like why certain muscles would work and did not work sometimes. They started just really examining like everything that was out there. And a big field of healing is the world of acupuncture and like the Eastern medicine field. And Dr. Goodhart, like really attached to that a lot, because one of the premises they have there is that every muscle of the body has a correlating organ that is part of how it like it functions, and that there's communication pathways there. The acupuncturists have been claiming it for, I mean, however long, because acupuncture is thousands of years old. We've kind of made that claim in our space since it started in the 60s. And in fact, there's actually just been more recent research, and a couple of blog posts about this on our website that came out about 5-6 years ago, where they started to identify this, which is really cool. The biggest one they found so far is the triceps and its connection to the pancreas. But in development in utero, as the infant starts, as the fetus starts to develop, there's different tissues that form, and those tissues they've come to identify as actually continue holding on to a communication pathway. And so they produce little proteins that communicate. So the triceps is the one we most know for sure via scientific research that there's this communication pathway there. So the triceps produces hormones that communicate to the pancreas. In fact, they've now identified that if someone has blood sugar imbalances, that strengthening your triceps and consistently using them on a regular basis will help to stabilize your blood sugar levels.
Wow.
So that's just like an example of how, like one example of how this could work. And so we don't have all those connections with some of the claims that we do make. But so, for example, pec major, which is a muscle of the shoulder, correlates to the stomach. The quads correlate to the small intestines, and the IT band, or what's called the tensa fasciolata, correlate to the large intestines. And so somewhere in there is when I was testing, where I would actually say, okay, test this, test this. So when we test those, let's say in your case it was the quads, like we'll be like, right, stomach's not testing, large intestines isn't testing, small intestines are both weak. We will have you hold the acupuncture point for the small intestines. And if that gives us the strength back to the muscle or the engagement, then we kind of pivot our thinking and say, this looks like it's a small intestines issue.
Okay. Interesting. And then, so same thing with like the foods, it's like a neurological input. Your body knows what you're holding on to, and you see if that helps or not.
Yeah, exactly. Yeah, exactly right.
Okay.
Or if it further, we call like an offender, if it further offends the muscle. So for example, with the foods, we might take a stomach muscle that's strong and then have you hold like gluten and see if it goes weak, and have you hold dairy and see it goes weak. And there's different ways that can be assessed in that situation. Back to the original kind of like history of applied kinesiology, initially and forever, they stuck to the premise of actual exposure, which, to be completely like forthright, actual exposure definitely has the most like validity to it. Like scientifically, we know how that would work. We can prove that that works. Where you say, hey, we actually put a little bit of gluten in your mouth, or had you even smell it, because through those cranial nerves, you can activate that as well. And then test the muscle. If it creates the weakness, then we look at that food as a potential offender to the body. Somewhere along the ways is that can be a very lengthy and tedious process. It was kind of looked at, examined, like, could we replicate this just with vials of those substances that people hold? And so with that, same thing you're looking at as an offender to your system. And you are definitely in that space moving into more of the idea of like electromagnetic frequency of that food, or even like the frequency that it puts off in your body's ability to interpret and understand that frequency. And while there's a lot of understanding and there really is a lot of science in the world of frequency medicine, it's definitely not as like accepted form of medicine.
Yeah, we love frequencies, but I agree. It's not.
I know.
Yeah. Yeah.
I know, right?
I know. That is so fascinating. Do you ever have people that like are super skeptical and are just like mind blown? Or do you ever have people that just like don't believe you and stop coming?
Yeah. So it's crazy. And I feel like it's part of like the shift in like the bigger like space right now. So like when I first started, this was a huge wall that I ran into. It was very often like, if people seem to be very open to me, do my testing and then do some adjustments and like, oh, my back feels better, this is awesome. And that side of it, they were like very open to, or injury rehab and things that seem to kind of directly correlate to this doctor testing my muscles. But then the other stuff that was just like, what are you doing? So it was almost more of, you had to kind of like convince people like, hey, if you just try this and then come back and like tell me how it goes, right? And a lot of everything we're using are very safe. It's easy to do. And so you'd have to kind of go that angle. In the past, how long would it be now? Like 6-7 years? Like, I feel like maybe it even correlates a lot with COVID, maybe like everything kind of flipping there. We now have people like actively seeking us out for this form of treatment and this form of medicine, which in my mind is almost kind of mind blowing, because this sounds funny. For as long as I've been doing it, I'm still even maybe one of the biggest like skeptics or critics of the work itself, because it's like, it still blows my mind. I'm like, I'm able to just hold this point and identify this and go through, but we see it every day. People come back, all right, this is getting better. This is getting better. This is going away, which is so cool. But that's where it is now. People seem to kind of want these different options, and they're very open to it. People come in all the time now, like, whatever you have to do, like, and I'll go through and give my explanations. Even they're like, I mean, sure, whatever. What do you need me to take? And I'm like, take this. Okay, we'll keep going.
Yeah. I always am like, okay, what are you doing? Can you explain it? Because I'm super interested, so I want to know. But I do imagine people that are like at the end of their rope and this is like the last thing they're trying. I imagine they're like, I'll do whatever. You just you just tell me what to do and I'll try it.
Yeah. Yeah. That happens all the time that people come in and then you see the results. And then the next thing you know, they're the very ones that are coming back in and are saying like, can you test me on this food? Like, I want to know if it's affecting me or not. Like, okay.
Hmm. That's so
That's neat.
cool. Rachel, what questions do you have? I know you have a bunch.
Yeah, no, I'm curious. I think, okay, one of the main things I'm curious about, I feel like every muscle testing practitioner has a little bit of a different stance of how they feel like the communication is going. So do you, and I'm constantly mind blown too that we can communicate with our bodies in these cool ways, like even though we see it work over and over again. So I'm curious if you have any kind of mental framework you could share with, do you feel like you're asking the body? Do you feel like you're asking the nervous system? Are you tapping into the spirit level? Like what goes on in your brain behind the scenes?
Yeah. In a certain way, from my standpoint, it depends on the process you're taking to go through that. So we have a lot of things in our training that is very neurological. And so a lot of those very direct inputs, like even Caty's example of where we'll test very specific muscles that correlate with these different things as we go through this pathway. And so a lot of times it can be that, but then there is a whole nother space in muscle testing. And you see it a lot with particularly the like emotional clearing work and emotional clearing techniques where it's a different type of cue. And sometimes it's a verbal cue. People ask about an emotion, like, are you feeling a sense of like grief? And then they'll test a muscle. And that's just like a very different type of cue. And I do get into that. I think it is that like integration, that like mind, spirit, body integration when it comes to that kind of testing. And that's really what you're like tapping into. And you can identify some amazing pieces of information from doing that.
Yeah, I personally feel the same way. I think that's so neat.
Yeah.
I'm curious, do you muscle test yourself? Do you feel like you can muscle test on yourself?
That's a good question. I do. But I will say that for me, it kind of was kind of difficult to come to that. It took a lot of years of hands-on working with people and going through that muscle testing process to feel like confident and accurate in that process of self-muscle testing. It's not as clear of a test. When you're working with somebody, you got this big old long muscle and you like get to test it. And you're like, oh, that's super strong. And then that's like super weak. Well, you don't have the same ability to yourself. So it's a little bit more, yeah. Do you as well? I'm assuming.
Yeah, but it took me so long. Which kind of leads to my next question is I feel like you have to be a good muscle tester, you have to really be able to remove your bias and you're just open. And I've seen a lot of even traditional, aka applied kinesiology practitioners who I feel like sometimes influence the results if they want a certain result. And clearly based on the results you get, like you are not doing that. You're non-biased, like you're open. And so do you do anything to help clear that out? Do you just have a mental stance? Have you noticed that difference in practitioners too?
Yes. Yeah, for sure. One of the things we'll see in our space is that a practitioner will kind of lock on to an idea as kind of what they think everybody's problem is, and then the next thing you know, they just everybody has mold. And I'm not saying a lot of people do have mold, right? But like and there's ways to prove that or whatever, but they'll get caught onto that, right? So it's like every person that comes in their office, it's like, oh yeah, another mold person. Like that's what they'll find when they do their muscle testing. In our training process, that's kind of where we like use multiple points of data in a way. So that is why, if we can, we do run blood works for certain tests and like see what that looks like. We try to correlate that to what we're finding in muscle testing and just try to like we want things to line up, people's like health history, what they're going through, what they're experiencing. Even in the muscle testing process that kind of we get trained in, there's even ways to what we try to like double or triple verify, where it's like we do have the muscle weakness correlating to the stomach. We also have pain at the stomach. We also have meridian points testing to the stomach. And so you're going multiple factors and going, okay, like everything seems to point to the stomach. But it definitely is like an exploratory process. And if you give up that exploratory process, then you often do fall into that just kind of personal bias.
That makes sense. Yeah. I think it's really neat that you're able to muscle test so accurately and helps so many people, because I feel like it, in my opinion, it takes like a really certain kind of person where you're able to hold the science in your mind and you're able to be so aware and have a lot of self-awareness so you can keep that exploratory process open. So I think that's really neat that you're able to hold both at once.
Yeah.
Yeah.
Yeah. Well, thanks.
Yeah. Yeah.
Yeah.
Well, I know we had talked about diving into the latching a little bit.
Yeah. So what is this called? Remind me what this is called again.
Yeah, my own office asks me this all the time. This is kind of, well, because there's things out there in the space. There's like cranial work, and now there's kind of coming a term that like people are calling it myocranial release work. That's
Okay.
probably what it would fall under. And there's no like official thing in this space. Like you can't go get like a certification or like a training in this space. And so what it's really come from is my own years of having trained in cranial work and fascial work in these different combinations, and then also having the tool of muscle testing to identify like specific ways to release. It's really kind of something I've developed in clinic over the years of working and having people come in with their infants that can't see the latch, are fussy, are having sleep issues, and just trying to, what can we do to help? As well as having 3 kids myself. Like I've had to do this. It all kind of started with my own kids where they too are having a struggle of feeding and latching and be like, surely I can do something. And yeah, so I don't know if there's an official name to it.
Okay. Okay. Yeah. So basically, the way that I found out about this is when my daughter was born, about like, I don't know, probably 6 to 8 weeks old, we noticed she had a lot of gas. She was really fussy. She had like silent reflux at first, and we figured out because she wasn't really spitting up, but you could literally smell like acid on her breath and she would cry. And so we did what most people do. We went to the pediatrician. We were like, hey, what's going on? What can we do? And they wanted to put her on a medication. And I was like, I don't think I like that. So I start like Googling stuff, and I thought, I wonder if Dr. Quinn could do something. Like what, maybe he can do something. So I called your office and they were like, oh yeah, he can see babies. And so by the time I got in to see you, she had started like projectile spitting up, which was horrifying for all of us because it was so bad. And so I brought her to you, and then, I mean, just right off the bat, it worked super well. So will you tell everyone like what it is that you did?
Yeah, I'd love to. And then I would love to hear more, like I'd love to hear that side of it too from your side.
Yeah.
Yeah. So number one thing for sure tends to be the latch itself. And a lot of people are talking now about like tongue ties, lip ties, and those kind of things. So those are all like connective tissue tension would be the way to put it. So if like there's too much connective tissue, then you have a higher amount of tension. So our cranium is made up of different bones, and those cranial bones are not solidified together. A lot of times we think of, because we've seen so many, pictures of skulls or human skulls or animal skulls, and it's just this solid as a rock thing. In a living person, this is still very malleable, and that's the most apparent and easiest to change when they are newborns and they're still small. In fact, you can even see that with like the soft spot and the breathing mechanisms and how it falls and rises. So the structure of those bones is going to determine the strength of the latch and the efficiency of the latch. So what we do is I'll throw a glove on, I'll go in and have them actually kind of suck on my finger in order to feel that. And then from that point, you can figure out like if the palate's too high, then it becomes like, then they struggle to actually get a complete suck. If it's too shallow, then it's really like they suck in too much and too fast. And so you can apply pressure to those palate sutures, is where we call it, where the bones actually come together, and release tension and start to shift the shape of that palate to a more like normal space, or where it needs to be. And you just do it. It's crazy because with infants, they respond so quick, and it's not a lot of pressure, and it's not anything that's forceful at all. And then to go along with that, you are also checking the other cranial suture lines and seeing if there's any overlaps there. When a baby's born, especially vaginally, the cranial bones have to overlap themselves in order to come through the vaginal canal, and then they should kind of pop back out and then fit into their space. But it doesn't always happen that way. So sometimes you'll see some overlap, you'll see some tension and rigidity there, and you go through and release those, and then you release the palate. And it will change yeah, the quality of the suck and the quality of the latch so that they can latch normal. And then the other factor there as well, you have in the fascial system, we have what is called the deep anterior fascial line, which starts underneath the tongue itself is part of that. It starts and connects under the jawline, runs down the neck and comes behind the sternum to the stomach, and it surrounds the stomach, and the stomach is part of that deep anterior fascial line. So you'll see that a lot with infants, especially because they'll sometimes go, if it's anterior where they get real tight and pull this way, it's the posterior line if they're always arching back this way. But we also will go in there and do just some releases between that stomach and the tongue, or if it's on the back, you got to do releases that way. Most of the time with projectile vomiting, it's the anterior line. So all this is so tense that there's pressure already being held against that stomach. So even though there should be some natural give and expansion, it just wants to come back the other way.
Mm-hmm.
So that's what we did. So we went through, made those corrections. If I recall right, I think it was just a couple times.
Yeah, I think we came 3 times.
3 times.
Yeah, and she like loved it. She was just super happy the whole time. She didn't really cry. She just was kind of like, okay, whatever, this is fine. So like you said, it's super gentle, and it's not like you have to take your baby to this really intense appointment where they're crying or anything like that. It's super gentle.
Yeah. And normally we have the parents, the mom, the dad, whoever's there, like they're the ones that hold the baby the whole time. So they're in their arms, and I'm just kind of working on them as we go. And sometimes, just to give a caveat, if someone hears this and they're like, oh my gosh, sometimes the first time or two, there can be some fussiness or crying just because it's a different experience for them. But otherwise, in those first couple sessions, like they get really used to it, and it usually calms them right down.
Yeah. And I mean, for her, it worked wonders. After those 3 sessions, like, I don't think she ever had a projectile spit up again. She started, I think like a few weeks later, she started sleeping through the night. She wasn't nearly as fussy. And also, if there are any moms listening to this, if your baby is really fussy and you feel like something is off, something probably is off. I'm a big believer in like mom's intuition. And so just because your doctor says they're fine and it's normal, it's okay to want to like seek something else out, because I knew like, no, something seems off, and I was right. And she was so much happier after we got all of that done.
I can't probably back you up enough on that comment. Like that is completely true. Yeah.
Yeah, all the people that have babies and they're like, yeah, they have colic and they're just screaming constantly, and like they'll grow out of it when they hit like 12 weeks old is what everyone says. I'm like, there has to be something going on. Babies aren't supposed to be screaming like they're in pain and inconsolable for 12 weeks straight.
Yeah, and if I can give an example on that, which is my oldest son, he'll love it. He'll probably never listen to this podcast, but he always loves when I ramble. Like he's 15 and he's at that age where like everything's embarrassing to him. So in fact, when he was young, he did have similar to your daughter, like the projectile vomiting, and I didn't know all this at the time. In fact, again, it was like with my own kids is part of what like drove me in to understand this. And he's the one that drove me into try to work more on cranial work and try to calm that down. And he went through this whole phase. And then eventually it appeared like he grew out of it. And then I learned all this years later. And it's interesting because now as a teenager, we've had to actually go back and still make corrections to this deep anterior fascial line for him, because he has, which everyone's seen it, like he has a very, very rounded like shoulders and like kind of pulled in at the chest. And so when he started developing, especially hitting his growth spurts, this started presenting. And I was like, oh my gosh, like I totally forgot. Like you projectile vomited as an infant for like weeks and months before you finally kind of grew out of it. Really what's happening is you're getting enough growth spurts and kind of enough stretching that it starts to happen naturally, that it starts to alleviate some of the vomiting, but you're not going through that. So we've had to go through and do some really heavy sessions with him in order to open that chest up, get his shoulders back. He runs track and he needs it. So
Yeah. That's so crazy that like, yeah, we think that babies grow out of all that, but that later in life you can start seeing the same thing kind of happen again.
Mm-hmm.
Yeah. While you were talking, I was thinking it's either really cool or your kids probably find it really annoying that you always can help know what's wrong with them, and you can constantly help support them from the home, probably.
I know. I would always be like, hey, come over here. Let me adjust you. Hold
Yeah,
on.
I would think
What
it's
do you-
amazing, but yeah.
Yes, it's funny. It's taken until now. Like what's funny is they used to they had no exposure to really any other type of doctors, and I'd work on it and they'd be like, Dad, this is weird. I'm like, why do you think this is weird, right? And so now they're at the point that like anytime anything's wrong, they're like, Dad, I need you to work on me. I'm like,
That's so
That's
funny.
awesome.
I imagine that when Ivy gets older, I'm going to have to try not to be a therapist all the time around her and psychoanalyze things. 'Cause I'm really good at doing that with like other family members. I don't do that to them anymore. But with your kid, I feel like if I see something, I'm going to want to help and fix it so fast. So yeah, I totally get that.
yeah, good luck. Yeah.
I know, right? I'm going to do it anyways.
Yeah.
Rachel, do you have any other questions about that?
Yeah, not that specifically. I think just, yeah, as we're kind of wrapping up here, I'm curious if there are any specific things that through your personal journey or through your professional journey that you wish people knew, or like something that you wish people paid attention to, or I don't know, a mental paradigm shift. Is there anything you'd like to share if you knew people were
Yeah.
listening?
Yeah, I think you hit it with that last one, with the mental paradigm shift. It's like the power of hope and kind of belief. And some people will look at that and be like, oh, it's a placebo effect. It's not a placebo effect. More and more stuff is coming out. In fact, Caty, you could probably like talk forever about this premise, like in the mental health world, of like recognizing that when we really have that hope and we really put in our own effort into our journey, that amazing things start to happen. And so one of the, I think, biggest mistakes we can do is, and I'm going to be careful with how this exactly is, like to relinquish complete control of our healing journey over to other people. To think that like, there's nothing I can do, so therefore I have to go to the doctor's office. And going to the doctor's office is important in that process, but to recognize that there is things that we need to do, and it's like it's your breathing choices, it's your eating habits, it's your mental state of being, of like being willing to wake up every morning and be like, I'm going to get up and I'm going to go because I'm trying to find this joy and this happiness in my life. And that creates a spark that just starts moving you through experiences. And those experiences are a huge part of just that whole healing process.
That's
Yeah.
beautiful. Yeah.
Yeah, and even with my clients, especially if they're really depressed or really anxious, I tell them, look, I know you don't want to get out of bed. I know you don't want to go do these things, but I need you to pretend like you do, like fake it for a little while, and then it will get easier. And I think you'll want to do these things. And so even with more severe mental illness, you still have a huge role to play in your own healing journey. So yeah, I think that's a super important message for anyone.
Yeah, I love that. Yeah, Caty and I love to focus on brain health. And I think that's one of the things that keeps the brain healthy is like doing good things for yourself and making yourself feel safe and keeping that hope and those positive messages in your head.
Yeah.
Awesome. Well, thank you so much for coming on, Dr. Quinn. It's been really great chatting with you.
Yeah, no, absolutely. Thank you for having me on. And I'll just kind of read it again. Just I think what you guys are doing is awesome. Like so let's spread this word, right? Like let other people know that this is a thing and that it's real. So.
Yeah,
Love it.
definitely. That's what we hope to do, and just give people like other things to think about, other options that they haven't heard of.
Yeah, more perspectives. Yeah. All right. Well, thank you everyone for tuning in, and we'll catch you next time.
Yep. Catch you in the next one.
Thanks for joining us for another weekly reset. If you loved hanging out with us today, subscribe so you never miss an episode, and share this with a friend who could use a little calm and connection too.
This show is for education and inspiration, not medical advice. To learn more or connect with us, check out the show notes below. Until next time, take care of your mind, your body, and your heart.